Good evening. My name is Michelle Naccarati-Chapkis, and I'm Executive Director of Women for a Healthy Environment. Thank you for the opportunity to present to you through video this evening. I'm sorry I can't be with you in person. I am out of town, but do appreciate the opportunity to present our story to all of you about who the organization is and the work that we do. Our organization was created about 5 years ago following the Women's Health and Environment Conference. That conference was an opportunity to talk about the science in everyday living, the science that focuses on environmental health risks and the impacts to our communities. Not only was the science presented in terms of new scientific information, studies, and research, but also solutions, so how consumers could take that information and incorporate healthy changes into everyday living. The conference was just a one-day event, and so we needed the opportunity, with all of the energy that came out of the room that day, to continue the discussion and the information gathering and sharing throughout the year, and that's what we do. Women for a Healthy Environment educates the community about these environmental health risks and provides information for educating the consumer so that they can make healthy, safe decisions through the home, the school, and the work setting. We also advocate for those policy solutions that better protect our health. One of the things that we focus on in terms of our educational programming are our food and consumer product use. So how to look at those things that we interact with every day and understanding what the risks are, such as the ingredients in the products that we use that may be harmful to us. We know that there's an increased rise in various health, disease, illness, and effects. For instance, we see an increase in autism in Western Pennsylvania. We see increases in cancer, learning disabilities, reproductive issues, as well as infertility. And we know through many scientific studies now that there are some leakages between environmental health and the diseases, the illnesses, and the products that we use every day. Many of these pieces of information are shared with the community in ways that we can translate and filter reliable scientific information to give people new, updated scientific findings. For instance, the Journal of Pediatrics had just released a report about the levels of phthalates, which is a chemical that gives plastic its elasticity. It also holds the scent to fragrances, so it's used in many products. Phthalates have been shown to increase blood pressure in children. Just this week, there was a scientific study that came out at the University of California, Davis, that looked at preschoolers and their increased health risks in terms of the food that they use or that they eat every week. So that study followed participants, looked at various various food items, and the amount of chemical exposures. So they looked at things like processed foods that had high levels of acrylamide. They looked at fish that contained high levels of mercury, fruits and veggies that had high amounts of pesticides on them. And this study was interesting because it looked at cumulative effects. Right now, many of the science studies that have been done in years past looked at chemicals individually, but we know that we're exposed to many different ingredients and chemicals on a daily basis, and so the cumulative effect of these is something that's very new and in an interesting focus in terms of trying to capture that data and looking at health risks associated with a younger population. Our educational programming looks at workshops and conferences and events, ways to engage the community. We just had a do-it-yourself workshop where participants made their own natural sunscreen and insect repellent, furniture polish, and scrubs, body scrubs. We make these engaging in terms of getting members of the community together to hear from experts in the region from a scientific and medical perspective. We also have events that engage young adults. This year we just launched a Teen on the Eco-Scene program. Our programs focus on two main areas: food and consumer product safety. That's how we describe our initiatives to the community, and our various speaking engagements and community events focus on these two areas. So here's the first quiz, the first question of the evening for all of you. How many of you walked into a store this week and picked up something off of the store shelf? It could be a retail outlet like a Target, or it could be your local grocery store. Okay, hands in the audience. Are you looking around at one another and laughing? I suspect many of you have raised your hand. If you haven't raised your hand, I suspect you may have had a family member walk into the store this week, or you did it within the last month. We as consumers walk into these stores and pick something off of a shelf, and we have the assumption and the expectation that it's been tested for safety. And unfortunately, that's not the case. When we have tabling events, we describe some of the products that we know people are purchasing off of the store shelf to give them an awareness of the various chemicals in the products that are being used. For instance, we have Clorox Cleanup as a good example. Clorox Cleanup with bleach, the active ingredient is sodium hypochlorite, 1.84%. Sodium hypochlorite, another name for bleach. And then it says other ingredients, 98.16%. However, that means that we don't know what the other 98.16% of the chemicals are that make up this particular product. And when you have to dedicate 3/4 of the back of the product, of the label, dedicated to the health risks associated with using it, we know that people should take caution. So you could try that at home. Go underneath your kitchen sink and see how many products are there that don't have the ingredients listed on the label. So we give information, tools, and tips for how to make safer choices in the home, the school, and the work setting. For instance, instead of the comment with bleach, getting back to the basics that our parents and our grandparents used to use, such things like baking soda, vinegar, are good, healthy substitutes. We provide recipes for do-it-yourself recipes around the home, cleaning around the home. We also give lists of ingredients to avoid and why these ingredients should be avoided in the products that we use. In terms of personal care product safety, we have on our table the soft soap antibacterial. We know this, just like the other antibacterial, antimicrobial soaps and sanitizers, are used frequently. And the active ingredient is triclosan. Triclosan is a particular ingredient that you'll find in antibacterial and antimicrobial products. What we're finding, though, is that people are overexposing themselves to these antibacterials, and when we need an antibiotic to work, they're not working as effectively. So we tell people, get back to basics once again, and use good old-fashioned soap. Plain soap and water will do. So we have here plain Castile soap that we recommend for people. In terms of food safety, we look at areas such as the hormones, the antibiotics, the pesticides in your foods, the preservatives in foods, the packaging that your food comes from. So for example, oftentimes children and adults are learned how to read nutrition labels on a food product. We know how to look at the fat content, the cholesterol, the sodium, the total carbs, potassium, etc. But when we get down to the ingredients, it's a little bit more confusing. When I pick up this dinosaur egg brown sugar instant oatmeal, which is really fun to eat, right? Because we pour on a little bit of hot water and the dinosaur eggs hatch, and we get these really cute critters then that we can eat. But when we look at the ingredients of what makes up these little critters, we see things like red 40 leg, yellow 6 leg, yellow 5 leg, and blue number 1. See, we know that there are lots of additives, preservatives, and other things added to food products that we want people to be aware of, because we know that there are harmful effects from all of the processed foods that are on the store shelf. So we give people healthier options to make. So, for instance, with this, you might just want to get the plain instant oatmeal minus the dinosaur eggs. We also talk about things in terms of walking into a store and understanding where our food comes from. So we really encourage the Buy Fresh, Buy Local program, and we work with community partners to really highlight those different farmers markets and CSA programs across the region. We also had this year hosted our first Farm to Community conference that talked about various initiatives in the region about getting access to food in underserved areas, but also looking at farm to school initiatives and how we can get farmers to work more closely with schools to offer fresh, local, raw foods as opposed to the processed food items. So for giving you more information about our science work and policy initiatives, we know that we have, our government has been doing a poor job of regulating chemicals in commerce. So we're very active through our state liaison. We are a state liaison for a national campaign called the Safer Chemicals, Healthy Families campaign, which is a way to reform toxic Substances Control Act. In addition to that, we also are a state liaison for the Campaign for Safe Cosmetics. So we bring these national issues to very much a regional level, and we give people the tools and understanding through all of the resources we provide for how to make healthier choices in everyday settings. We all have stories that really impact our life. in terms of health effects that reach right into our communities and our homes. So for instance, I have 2 children who have been diagnosed with asthma. One is very active on treatment. And I have a cousin who at 44 needed a double mastectomy. I have another cousin whose son is being under therapy for autism. We hear very often when we go and do various speaking engagements and community discussions about stories that of health effects that impact people that we talk with. I had a mother come up to me after one speaking engagement and really was upset because she talked about how her 2 daughters had gone through puberty at ages 7 and 8. And she talked with her pediatrician, and her pediatrician talked about some of the exposures in their home in terms of the cleaning products, the personal care products that they use, and how to make safer, healthier choices in terms of ingredients to avoid and the various recipes that we talk about through do-it-yourself products. My story is not unique, and many of you have your own stories to share. We know that in our region we have these hotspots. We know that Western PA is certainly been known for its rise of autism in children in our region. We see these increased cancer diagnoses, learning disabilities in children, reproductive harm, and we find that there are many linkages in terms of the environmental exposures that we have every day through our home, our school, or our work settings in terms of consumer products and food that we ingest, inhale, and absorb. So we are here to ask you to take 3 minutes now the next time you go to a store and look at a product that you need to replenish in your home. So here's the action item for all of you. Next time you go to your store to buy a soap, a deodorant, a shampoo, take a minute to pull out the wallet card that you all have been supplied with in your packets. Look at those ingredients to avoid in your wallet card and see if any of those ingredients are in your personal care products that you use. And if so, take a minute or 2 to look for other products on the store shelf that might be healthier and safer alternatives. I can challenge you to try to make your own product through the do-it-yourself recipes that are in our kits as well. You can take one simple step to replace an item in your home, or to look at your workplace and ask them to replace one item, such as the Glade plug-in that might be sitting on the bathroom counter, or in the school in terms of a cleaning product that they might be using. Then we are making one step toward creating a healthier self, a healthier community, and a healthier environment. So in closing this evening, again, thank you for your time. I hope you've learned just a little bit of information to take away and share with family, friends, colleagues, that you can take some of the action steps that we address. Review the information in your packet. I know there will be good information and valuable resources for all of you to share. And take these steps to create an optimal health for you, your families, and for our community and environment. Thank you again for your time. Feel free to follow up with us regarding any questions you have about the presentation. Good evening.